The whole gang's here.
So, Dr. Stacey, first of all, I love saying that. I've never called you that. I am just so excited. So, guys, I consulted with Dr. Stacey. Let me back it up. Dr. Stacey and I are best friends. We've been best friends since we were 5 years old. We call ourselves the S4Ls, which stands for Sisters for Life. Our third S4L is in here, Bun BB, Bernita. And so to be able to do this, with you, Stacey, or Dr. Stacey, is very exciting for me. I asked her because we've had so many conversations about healthcare, period. Fibroids, the system, the things that you see as a practicing physician. And I'm like, you have so much, there's so much that needs to be told. You have so many insights. And when I decided to create this suppository, I asked Dr. Stacey if she would be willing to kind of give us her expertise on a broad range of topics. So today we're starting with, every Tuesday going forward, we're going to go live with Dr. Stacey or have some sort of information that Dr. Stacey will provide us to just learn more about all the things. And today, for our first Tuesday Tea with Dr. Stacey Godley, we're going to talk about fibroids. So I want to be quiet for a second. And Dr. Stacey, I'm going to allow you to introduce yourself to the people.
Hello, everyone. I'm Dr. Stacey Godley. I'm a board-certified OB-GYN practicing in Houston, Texas, and I'm originally from Milwaukee, Wisconsin. I went to undergrad at Xavier University in Louisiana, and then I got my medical degree from the Medical College of Wisconsin. And then I did my residency in obstetrics and gynecology in Milwaukee as well. So I'm happy to be here. Thank you for having me, Jubie.
So happy to have you. So we can get right into it and start talking about fibroids. This was an important topic for me. I've mentioned it several times that, I actually just found out my mother, so Mama Sue had fibroids, so I didn't know that. I know that she had endometriosis growing up, but she just recently told me she also suffered from fibroids. Several of my girlfriends are managing life with it. I've had, I think, 2 girlfriends that went through a myomectomy. I had another girlfriend who was considering a hysterectomy. And then a couple other friends that are just kind of living with the pain and still trying to figure out what path they want to take. And so knowing that this has impacted so many people that are close to me, and then doing the research and seeing that by the age of 50, 90% of Black women will have fibroids. Something like 80% of white women will have fibroids. I wanted to talk about, it's an important topic. So to get started, Dr. Stacey, can you just give us an overview of what fibroids are?
So fibroids are benign tumors of the uterus. They grow in the muscle, and they can kind of manifest in different ways. So you can have them on the inside of the uterus, which is in the cavity, which is where the baby grows and all that stuff. You can have it in the middle, between the outside and the inside. It's called the myometrium. So that's basically the muscle of the uterus. And then you can have them on the outside. Those are serosal fibroids. So those really don't bother people too much because they don't really impact your bleeding or anything like that. They can become painful, though, if they're large. So they're benign tumors, meaning they are not cancerous.
Okay.
And they are very mysterious. We don't really have a lot of information about why women get fibroids and where they come from. We have a little bit of knowledge about what feeds them, and that's our hormones, specifically the hormone estrogen. So as you are, a growing, healthy, ovulating woman, and you have normal hormones in your body circulating, they will feed these fibroids if you develop them. And so they're not cancerous, but there is a small percentage of tumors that can look like fibroids, but they can be cancerous. So that's why it's not something you should ever ignore. You should always get medical attention if you suspect that you have them, just because sometimes you may have something a little bit more serious, but a fibroid can really, really impact your life.
So can you, because you mentioned it sounds like you can have them almost in 3 or 4 different areas. Is it possible for women to have them in all of them? Yes. All those areas?
Or you call that your uterus can be studded with fibroids, meaning it can have fibroids, as you might imagine, like on a bracelet, like diamonds, right? Just all over the place. And those fibroids are a little bit harder to treat, especially if you're a woman still wanting to have children.
Right.
So that's why it's important.
It's in your womb.
Exactly. It consumes everything. And you need all of those parts of your uterus to be functional, right? To carry a pregnancy to term. You need the muscle to be nice and strong so that it can hold the pregnancy. You need the cavity to be nice and healthy so that it can maintain the pregnancy as well. You need the outside of the uterus to be intact so that the uterus doesn't break open like when you're having contractions. All of those things have to be in unison for you to have a successful pregnancy. So you need to seek care sooner than later if you suspect you have fibroids, because if they really consume your uterus, that can make it a little difficult to take care of it without destroying or damaging your uterus.
So does everyone that have fibroids experience complications? Because that's a really high percentage of women. That's basically, or any person with a vagina will potentially have fibroids in their lifetime. So is it always that impactful?
Not always. So some people can have fibroids and not know it, right? Some people will have normal menstrual cycles. They won't have any impact on, their daily activities. And some women have significant pain with fibroids. They can have horrible, heavy bleeding during their menstrual cycles, sometimes bleeding so much that they need to go to the hospital and get blood transfusions. Some women have impact on their sex life. It hurts, quite frankly, because of fibroids. We'll get into that. That it impacts that. Sometimes the fibroids can be so bulky that you will have difficulty going to the bathroom. So you can't pee, you can't poop, because the fibroids are sitting on the bladder or on the intestines or, on the colon. So you will see many different manifestations of fibroids, and they can mimic almost anything that you can think of. So it's hard to nail it down. But typically, the main thing is bleeding. That's the main thing that brings women in is really painful periods and heavy bleeding.
Okay. Because there is a statistic, I think it was like Black women are 2 to 3 times more. I always confuse that in my head. But Black women are 2 to 3 times more likely to experience complications like all of the symptoms and all the pain that you just described. And I realized that, this is so impactful that it impacts, virtually every kind of part of who you are. I mean, it impacts my ability to potentially reproduce and have children. It impacts how I look physically, because sometimes you have a protrusion and it looks like you're pregnant, but you're not. It's a fibroid. A lot of young women experience that. And that may be that sometimes you have people who are like, I live in the gym, right? I just did a panel recently with a young lady, and she said, I lived in the gym and my stomach was sticking out, and I just thought I needed to go harder in the gym. Right? Thinking that it was fibroids, and she grew up and she was told heavy, painful periods is just Mother Nature, honey. You just have to deal. Let's talk about it. Yes. I want to talk about that, because I think that is so important. I think that at least I know in our community, a lot of times, well, my mother, Mama Sue, she did she was really good about that kind of stuff, right? But I think that there are it's just a thing that we're just taught you just have to deal with. You have a period, it sucks, you bleed, and it hurts, and you deal with it and you move on. But I think that when women have extremely, extremely painful periods, I think the expectation that we have is that is common, and you don't think that maybe there's something wrong. So I wanted to talk a little bit about that, because I just think it's important for people to know, like, your period really shouldn't be that painful, right?
Exactly.
Like, is there any marker or any threshold or anything that we can kind of guide people to know? Like, if you're bending over, you can't move. I don't know what you would suggest, but.
So typically everybody's pain threshold is different, right? Some people are double over in pain if, they get a scrape on it. So,
right, sure.
Engage with the pain meter, but we usually talk about how much bleeding you're having, right? So we basically tell patients to do like a pad count. Now they have things about there should be a teaspoon of whatever, but nobody's really thinking about it like that. Like, you should be looking at the number of pads that you're soaking. Heavy bleeding or hemorrhage really technically when you're bleeding and you have like a super pad, like one of those long, like overnight pads on, and you're soaking more, you have on a pad, you're soaking through that, and you put another one, you soak through that in an hour. So more than 2 pads in an hour, that's too much bleeding. That's too much bleeding.
What should you do?
So if you're bleeding like that and you're bleeding like that on a consistent basis, I guarantee you are anemic. Okay. So you're going to already be feeling lethargic. You're going to be, some people are always cold. They feel like they're very cold. Some people, when they stand up, their heart starts racing. They may get short of breath even from having anemia, and they don't even know that it's because you're bleeding so much during your cycle. So when you have this kind of heavy bleeding, it's always, a good idea to consult with your physician, to talk to an OB-GYN. And also you can see a family medicine doctor. They have some OB-GYN training as well. So they will know information about your cycles and what's normal and what's not. And they can kind of help you through that.
Okay. So you'll consult with your gynecologist or your OB-GYN, and they should be able to kind of help you through that conversation. Is there any information that you think would be helpful as a doctor, like for patients to bring?
Yeah, I'm thinking that. So a period journal, right? So you document your cycles. You write down day 1, this is what I'm feeling. This is the number of pads that I soaked. I had to use Super Plus tampons on top of pads today. I had to take this number of Tylenol or ibuprofen or whatever. Like if you have a journal, we can look through that, kind of like your dietitian would do if you have like a food journal, right? We can look through the journal and see what the pattern of your cycles, has been. And then also, of course, keeping a record of when your cycles are happening. Some type of calendar. They have apps for that you can, download and take a look and see where your cycle is falling. And if there are any skip cycles, that kind of gives us some clues about some things that may be happening around ovulation. So those are some things that you can do before your visit. I'm glad you asked. That's a great question. Before your visit, go in there with information about your body. Just don't go in there like, I don't know, I feel like I'm bleeding heavy. It's really like you need to be
very specific. And that helps you do what? That helps you understand like what moves to make, how to determine what you have.
What tests to order, even like what tests to order. If you tell me 3 months ago, my periods were normal. They were happening every month. They were regular. I bled for 3 days. First day was the heavy, then it got lighter. I barely used the Tylenol. Now I have 7-day periods. They're unpredictable. I'm bleeding heavily all those days. I'm feeling very tired and drained. I'm passing large blood clots. Those are important things to know because there's been a change, right? So to start looking for something. Usually something like that would trigger me to think, okay, there's a fibroid that has grown. Okay, there's a fibroid somewhere. Cause that, you can sometimes see that if you have thyroid issues. So that's another thing. Your doctor will know to do a full workup. Any kind of abnormal bleeding doesn't automatically mean fibroids. It could mean hormonal issues. You could have some other things going on, like I mentioned, your thyroid. So you just need to get checked out. But certainly some of those words, those buzzwords, passing large clots, double protection, right? You have to wear a pad and a tampon. I never wear white. I never leave the house on the day of my period. Different things like that. I have to stay on the heating pad. All of those things kind of, sound very similar to a woman struggling with fibroids. So we'll pick up on that right away, and we'll know to order, ultrasounds. And then like I said, we'll do some lab work, check to see if you're anemic. You'll most likely leave the clinic that day with some prescription pills for iron and maybe, some other things that we'll talk about.
Okay. So I feel like you just gave us so many gems. So thank you. We talked a lot about sort of what to expect or what to come, how to be prepared to come to that appointment. Once you get there, and we won't talk too much about this because I want this to be another topic, which we'll get into next Tuesday, which is patient advocacy.
Yes.
But maybe just at a high level, because I have friends that have told me about stories where they've gone to the ER where they're in excruciating pain and they got shooed and we're told you're just having a bad, period. And it turns out her cyst burst. Yeah. So I really want people to, like I said, we'll get into this in great detail in another episode or session, but if you just feel like you aren't being heard, what do you suggest someone does?
So that is one of the big issues. It's a hot button issue in medicine, right? Everybody's talking about it since COVID, since, really George Floyd. People are talking about racial biases. It's a real thing. It does not escape the practice of medicine. In fact, a lot of very racist practices happened in medicine that we're very familiar with. Dr. Sims, who was a father of gynecology, came up with a lot of crazy different techniques working on slaves, didn't give them anesthesia, different things like that. So some of the things that we've learned about the woman's body came from these very horrible practices. Of course, everybody, familiar with Tuskegee. So there's good reason for us to feel a little bit, leery about the medical system, right? When you have an issue. That being said, there are so many, especially when you live in a place like Houston or Baltimore, there's a network of Black doctors, right? There's a network of doctors of color. There's a network of doctors wherever, that you can always see somebody and go get a second opinion from someone else. You just contact your insurance and say, hey, I saw this doctor. They're in network. This didn't work for me. Who's another doctor in my area? They should be able to provide that information for you, or you can go on, Humana or United Healthcare's websites. They usually list like the top doctors. Now, I'll tell you this about those doctor lists, though. Those are doctors that keep the costs low, so they may not order all the tests. You see what I'm saying?
Sometimes, you mean the doctors that the insurance recommend you to?
Who are like their top ranked people. Because they're like the best doctors. It's just doctors that practice a certain way that they like. I'll just say that.
Okay, let's get into this. We're going to get into this. we'll get into that next Tuesday.
But yes, you must find a doctor that you connect with, especially as a woman. You have to have a good OB-GYN. You have to have someone you trust. Yeah. You have to be able to, this is somebody that's going to be very all up in your body, like knowing, like very intimate with you. They're going to see parts of your body your partner will never see.
Right.
So you have to make sure that you are taking the time to do the research for yourself, not just listen to mom and them. Oh, this is who delivered your mom or your cousins, because that person probably is practicing 1950s medicine. You see what I'm saying? So the recommendations,
we don't want that.
The recommendations from that doctor on how to treat fibroids is not going to be up to date. So you need to find somebody.
Talk about that.
You need to find somebody knowledgeable. And if you go and you make a consultation, you don't have to go see somebody just because, we have a well woman slot or whatever. No, you book a consultation. I want to talk about my fibroids, and they should be able to sit with you 15, 20 minutes, whatever it takes. And then you decide from there if you want to carry on with that person. You don't have to subject yourself to a well woman visit to introduce yourself to a doctor. You can come in for a consultation. Okay.
I never knew that. I never knew you could come in for a consultation.
Yes, ma'am. Well, consultation.
Yeah, I never knew that.
Yeah.
That's really good to know. I think what I'm hearing you say is, if you in your gut, because I'm all about vibes, we feel it. We know if this is a good vibe or not. You trust your gut, and if you feel like you maybe don't understand, or the doctor didn't take the time to help you understand what's going on, whatever the reason is, there's just something not settling right with you, get a second opinion.
That's it. And
period.
Emergency room, go down the street.
Right.
If you leave there and you saying my chest hurts, I think I'm having a heart attack, and nobody even pulled out a stethoscope and listened to your heart or lungs or gave you an EKG, go to the next emergency room. You feel me? Okay.
I feel like a lot of times we invest, we sort of, well, I can only speak for myself. I mentioned this to Amber from Carpools to Cocktails. She's on here. Hi, Amber. When we went live the other day, I feel like once I realized, as I got a certain, old enough to realize that a lot of people are full of shit, that it also transitions over to doctors. I used to kind of put doctors on a certain pedestal because I've had all this schooling. I don't really know a whole lot about what's going on inside my body and biology and all that. So I just assume that I'm being taken care of. And what I'm learning is that absolutely not, especially when it comes to racial biases, when it comes to just reproductive health, period.
Yes.
When it comes to what really understanding what our treatment options are, which we'll get into right now, specifically for fibroids. Yeah. We'll transition into that now because I kind of forgot what point I was going to make. Sorry about that.
But the point is, yes, you need to advocate for yourself. You need to find a doctor
to advocate for yourself.
And you need to make sure that you don't give up. Don't get discouraged. You might run into some people who will be dismissive. That is a common thing. You're a Black woman. You're strong. You should be able to handle pain. You ain't here looking for drugs. That's what people
on it.
That's so you have to pack up. Never mind. Let me go down the road and find someone else who's going to listen to you and take your concerns seriously.
Yes. That's so important. If you don't feel right, find somebody else. You want to know that you're being taken care of by somebody who is really considering you, your situation, what you want for your future, and they're really open to providing all of the possible options so you can make an informed decision. It's so important. So let's talk about, we talked about the symptoms. We talked about heavy bleeding. We talked about pain. We talked about painful sex, a protrusion in your belly. How do you, as a doctor, what do you typically recommend just to sort of treat the symptoms, not the removal, but just to treat those symptoms, because these symptoms can happen day to day for women?
Okay, so I'm gonna just answer this question. Power in My Skin asks, what are some holistic remedies that will aid fibroids? So that's a question I get a lot. So let me start there before I get into therapy. Let me talk about some of the holistic things that people are, talking about. Everybody's like, do the water diet, do Dr. Sebi, become vegan, remove dairy, remove meat. Now, there is some studies that suggest that removal of dairy and meat from your diet can help with the treatment of fibroids. And I believe, in my mind, it makes sense because those things are fortified with hormones. So you want to get rid of those things that may be feeding your fibroids. So that just makes sense. Right. The other kind of fad stuff, I'll, kind of stay away from that. But I don't think it's ever like a bad approach to get a team together. Right. So if you're dealing with fibroids, it will never hurt you to go see a nutritionist, right? That won't ever hurt you. It won't ever hurt you to see your gynecologist, right? And get a full workup there. It will never hurt you also to have like a, family medicine doctor who can kind of fill in the gaps and make sure that there's not something else going on with like your intestines, like some GI issues or some other things that may mimic fibroids, right? Or may mimic some of the pain that you will have with fibroids. So it doesn't hurt you to assemble a group of people, right, that are going to, kind of walk.
Never thought about this. Yes, this is
so. That is one approach. The other thing is, basically, you want to look into making sure that you're not doing something that's going to be harmful. I have a lot of patients, I've talked to people who actually I went vegan and my periods got worse. Why? Because their period was fortified with soy. Soy is a compound that breaks down into estrogen. People don't know that.
Oh.
And it's making you worse.
Oh,
it's not a soy-based things, and it's making you worse. So you need to know what you're putting in your body. Some of these things, it's natural, it's plant-based, but it's not going to help your fibroids. Okay, so I always want to make that point. Yes, you can go vegan, you can go vegetarian, you can go da-da-da-da. Stay away from soy.
Okay.
That's that. As far as medical therapy, when we start introducing kind of what we will do to treat fibroids, the basic medication is NSAIDs. Those are ibuprofen, Aleve, pampering. Over-the-counter things. Not so much. Tylenol doesn't do the same thing as these medicines. These medicines are anti-inflammatories. And what they will do is they'll kind of basically make the muscle of the uterus, because when you're having your period, your muscle is contracting. So these anti-inflammatories kind of slow that contraction down. It kind of calms it down, helps the inflammation go down that is affiliated with your menstrual cycles. And you can see about a 30% reduction in the amount of bleeding that you have. You can definitely have some pain relief. So they do work. They do work. The issue is sometimes you have to be on top of it. Like you got to take them every 6 hours. You got to be faithful with it.
And this is the over-the-counter, right?
It's over-the-counter. So this is Aleve. This is, Advil. This is, those different things. Motrin.
And you could be doing this several times a day throughout for years. Because people have, I don't know, if there's anyone here that may not know, but I mean, there are women that are managing life with complications from fibroids for years.
Yeah. So that's one strategy. If they're small fibroids and they're not surgically, it's not necessary to remove them surgically, you can live with fibroids. You can manage them and you can keep them from growing. You can, it's possible. So this is one of the things that we know can be helpful because it will definitely reduce the amount of inflammation that you have. Your bleeding will be less and your pain will be less. So anti-inflammatory drugs like your Advil, your Aleve, your Motrin, naproxen, things like that are going to help you. Next one is, the next step up from that is actually something that will attenuate your hormones. So that's a birth control pill, essentially. Okay. When we start talking about fibroids, at most of the time it's women that are in like their 30s and 40s, and some of them have had, their tubes tied already. So when you talk about birth control pills, they're kind of like, I was hoping to never have to use this stuff again because I have my tubes tied. But birth control pills really are very helpful. Like in a basic kind of OB-GYN practice, you'll use birth control for many different things. One of the uses that it has. So the point of it is, as a woman, your hormones are fluctuating like this all month. That's just what happens. The birth control pill makes it like this. Okay, so that's the point.
Makes sense.
You want to just manage and keep the hormones at a steady state so you're not getting big swings in hormone, big swings in estrogen that's going to feed that fibroid. You want to keep that hormone level steady so that hopefully, it will definitely help the symptoms, but hopefully it'll keep the fibroid from growing. Okay, so that's...
Go ahead. Sorry. Go ahead.
That's kind of the goal. That's one of the ways to kind of manage it without having to do anything more invasive.
Okay. So can we take a step back, go to the OTC for long-term use? That's not ideal, right?
Well, yeah. So you using any kind of NSAID over time is definitely not recommended just because it can have an effect on your kidneys. So you don't want to be popping Motrin all day, every day for long periods of time. So you definitely want to kind of see if there's any way that you can do that, maybe for a few months, maybe come off, see if it's happening or changing, talk to your doctor, see if there's some other options. But certainly you don't want to hurt your...
Other options, y'all. That's what this is for. This is a natural alternative. These suppositories are a natural alternative to the over-the-counter that are safe for you, so you don't have to worry about those long-term issues. So that's an option to consider too. And then with the birth control, like you said, a lot of women, we realize that we have fibroids a little bit later in life, maybe after we've had children or whatever. So could be 30s, 40s, 50s, whatever. Is it okay? Because I always thought that you're supposed to stop taking those after a certain age. And I thought it was kind of young, like 40 or 35 or something. I don't know. But is it okay to?
You can use them pretty much up until menopause, like birth control. Pills, birth control, your Mirena IUD, all those things can be used up until basically you become menopausal. And we do use those things for different reasons, just so that you can manage things without having to resort to some kind of surgery. Because I'll tell you this, and we'll talk about this a little bit later, but I know the dream of not having a period, it sounds amazing, but having your uterus taken out at 30, no bueno.
It makes me so sad.
Your bladder is supported, literally, it sits on top of the uterus. So what's going to happen when your uterus is gone? That bladder is going to fall, honey. You're going to start having leaking issues. It's not cute. You are 30 years old and having issues with incontinence. So
we'll get into that because we're going to talk in a minute. We'll talk about the remove options.
Are told that that's what all they have, but okay, go ahead.
Yeah, we'll get into that. That's what I want to make sure I do answer one of the questions that came up. Hey Nahi, love you. She said, are there preventative measures someone can take to prevent regrowth of fibroids after getting them removed?
So, unfortunately, most likely the answer to that is no, unless you're taking some type of low dose birth control pill or something to, like I said, kind of attenuate the hormones that do feed them. I don't think it's ever a bad idea to see what's in your diet, see if changing your diet will help, see if, get a
no soy.
No
we
soy.
do know that. No soy. Mm-hmm.
Get yourself a personal trainer, get more active. We know a lot of times athletes, their periods are not as bad, so there may be something to that. But yes, as far as we know, there's nothing we can do to prevent them from coming back. It's a genetic thing. So, or it's multifactorial, but mostly we think that if some people's fibroids come back, some people's don't. The people who do have a tendency to have fibroids regrow, it may be genetic.
Okay.
Those are some of the strategies I would employ. I would, just diet, exercise, maybe a low-dose birth control pill, and follow up with your doctor. See them every couple of months for ultrasounds.
For ultrasounds, that's important. Okay. And then LaShawn 316 asked, does what you eat make them grow? And you kind of touched on that. We know soy is not good. But typically you just would encourage to have a healthy, balanced diet and exercise. But there's really nothing.
Not a lot of red meat, not a lot of refined sugars, all the things that we hear kind of, you want to eat, more natural foods, fruits, vegetables, organic is preferred. Things like that.
Okay. So now let's get into the removal topic. So this one is so important because, like you said, there are women at 30 years old that are having to choose between wanting to have a child in the future, maybe someday, and living with pain. And they're being told that their only option is a hysterectomy.
Yes.
So if you could just maybe briefly tell us what a hysterectomy is, and then we'll talk a little bit about why is that so commonly, I don't know if commonly is a word, but why is it recommended so often? And then we can talk about the alternatives.
So hysterectomy is just a very, old school, real quick approach to, managing all kinds of, female related pains. You have people who have endometriosis, you have people who have fibroids, you have people who have all kinds of different things. And back in the day, the remedy was when you're done having those kids, rip that uterus out. Okay.
It makes me so mad.
That is something that, some, old school doctors still kind of stick to. And in my patient advocacy piece, I'll also talk about how, a lot of surgeons want to bill for surgery. Okay. So treating you with medications or treating you with some of these other methods may not be as lucrative as going in for a hysterectomy, quite frankly. So those are some other things you need to be aware of just as a patient. That being said, when you remove the fibroid or when you remove the uterus, that's called a hysterectomy. There's many different ways to do it. You can do it abdominally, so they'll do a C-section scar, so the side to side bikini cut. They can do it laparoscopically, so they make a small incision in your belly button, and then they make smaller incisions on the sides of your belly to put little instruments. The middle incision is where they put the camera. That's one of my favorite surgeries to do. It's fun. And you basically take down all the attachments. So you're going to keep the ovaries in. If this is somebody who hasn't been through menopause, you leave the ovaries behind.
And this, you're talking about the hysterectomy, correct?
Okay. Yep. So you leave the ovaries behind. You take out the tubes and the whole uterus. Now, the reason we remove the tubes is because we've realized over the years that people who have had a hysterectomy and their tubes are left in, the tubes somehow influence the development of ovarian cancer. If you develop ovarian cancer,
okay.
So we just take
that's like what am I trying to say? It's proactive. It's almost like we're taking them out just to. There's no reason for you to have them.
Take out those tubes. Just leave the ovaries behind. Take out those tubes. So then another way that's really cool too is another one of my favorite surgeries, a vaginal approach. This has no incisions on the belly at all. So you have a vaginal hysterectomy. They do kind of what we do from above. They do it from the below, but in reverse. Okay. So they start in the vagina and then they work their way up and close the top of the vagina. And so that is a definitive surgery. Once your uterus is gone, it's gone. Obviously, there's no going back. You won't have periods anymore. The fibroids are not going to plague you anymore. But like I said, the bladder is supported by the uterus. So sometimes if there's not any attention taken to make sure that the bladder is still having a good support, you can see, over time your bladder starting to descend. Wow. And you will have confidence issues before you probably would have. So that's why I tell young women, really think about it, really talk to people that I had some of my own college friends talk about, I had my uterus removed when I was 33. What? And you didn't call me? Like, you didn't talk to me? You didn't say anything like, Stacey, I'm struggling over here.
Right.
I really recommend. Like, I would give you a name of somebody that, told you go see this person, like took your uterus out when you were 33, girl. Wow. I was
but also, can I say maybe in the friend, in the case of your friends at school, they should have known better. They should have contacted you because they have you. I have you.
Like, we're gonna save the live, Tashia. We're gonna save the live, girl.
Thanks, Tashia. This is so many gems. I love it. But I was gonna ask you, so sometimes though you're kind of told that is your option as if it's your only option. Right. And so like you said before, a lot of times that's the only option, especially for maybe an older doctor, because that's all they know how to perform. Right. So it comes down to your doctor knowing different methods to perform, which could be the outcome or what they tell you need to do. Right. So that's what's driving the solution that they're proposing for you versus let me tell you all of your options. I don't do
over all the options.
I don't do half of them, but these are all of them, and I can refer you. Like, that's what the type of doctors we need. Right.
Yeah. It's when you go through all of them, there's a lot. So let me go through it, some more of them quickly. So then stepping back from a hysterectomy, we have a myomectomy. That's going into the muscle. Myo means muscle in Latin. So you're removing the fibroid from the muscle. You're basically plucking them out. You kind of like tease them out. That's a really fun surgery to do too. And a lot of people do those, do it with the robot. They do it robotically, which is...
Oh, wow.
It's like a little video game. But anyway, so they take out the fibroid and then they sew up the muscle. So they repair it. The goal there is to remove all the fibroids without damaging the inside or the lining of the uterus. Because if that lining is breached, you worry that when you get pregnant, the placenta will implant abnormally, and you may get some issues during pregnancy with bleeding, placenta previa, where the placenta covers the cervix. Like, it's all different things that can happen that are bad. Okay. So you want to get those fibroids out without destroying the integrity of the lining of the uterus or the cavity. So that's a big key to that one. And that takes a skilled surgeon to do. That is something that somebody has to be experienced with to get very good. Mm-hmm.
So question for you on that. So for a person who does want to remove the fibroids, they may want to have children, or even if they don't want to have children, they just don't want to get rid of their uterus and they're not ready to get a hysterectomy and they choose the myomectomy. Should you work with a doctor where that's kind of all they do? I don't know if that matters so much, or
see somebody who's a specialist. So one of my line sister, actually, she's a fibroid specialist in Atlanta. This is what she does. So she did an OB-GYN residency like I did, but then she went on to minimally invasive fellowship where she learned advanced surgical techniques. And she has built a whole practice around fibroids in Atlanta. So she uses a device called Assessa, and she basically removes the fibroid. She uses it's like ultrasound kind of technology that is dedicated to basically zapping the fibroid itself. So you go in laparoscopically, you direct this energy into the fibroid, and then the fibroid slowly degenerates, it slowly dies. Okay. And then your body will get rid of it. Okay. So that's one way to get rid of the fibroids without even doing any cutting on the uterus.
What is this called?
Acessa.
Acessa. ACCESSA?
Yes. So
Acessa. Okay.
Like, this is what I would love to tell young women when they come, and they're like, oh, I just want the fibroids removed. Well, this is one way you can have them removed. And then, it's not so touch and go like the myomectomy, right? Because the myomectomy it has to be done delicately. And plus, I don't recommend myomectomy unless you're trying to get pregnant. If you're trying to get pregnant within the next year, a myomectomy is fine. But if you're not trying to get pregnant, it's like you remove the fibroids, but then they may grow back. You feel me? And you've already gone. So this way, it destroys the fibroid, and at that site, the fibroid is not going to come back. You see what I'm saying?
So why wouldn't you always just do an Acessa? Is it because a lot of people don't know how to perform them?
Well, it's a newer technology. There's another technology called Sonata, and they go through vaginally and pretty much do the same thing, but they go from inside the cavity they go from the inside. So the Acessa's on the outside, the Sonata's on the inside, but they use pretty much the same technology to target the fibroid and, get it to shrink over time. So it's a newer thing. A lot of insurance carriers don't, cover it. Especially
pay out of pocket.
If you have Medicaid, probably not. If you have an older physician, they probably haven't heard of it. So that's kind of where, a lot of these things fall out. If you're a young woman, you're a teacher, you have good insurance, boo. You can probably get this procedure and be back to work and have a wonderful life. Okay.
Yeah.
And without any kind of invasive treatments. And then there's uterine artery embolization, which is something that we hear, or uterine fibroid embolization, UFE, UAE. That's another technology. Now, OB-GYNs don't perform that. That's done by interventional radiologists. So you would make an appointment with them, and they would, kind of tell you what their success rates are. That's what I always tell patients. Like, when you go to see them, they should be able to tell you, these are the success stories I've had. These are the, numbers of patients who have come back after this procedure and still needing a hysterectomy. They should be able to give you those numbers, and that should help you decide if this is for you. And same thing if you do the Acessa or the Sonata. When you see somebody, ask them for their numbers too. What are their success rates? Even though it's newer technology, they should still be able to tell you, oh yeah, I had a woman whose uterus was studded with fibroids. She came back, everything looked good. She was able to get pregnant in 3 months. Whatever the case is, you should be able to get that information from them, and then kind of decide, what's best for you.
That's a jewel, y'all. Like, ask for success rates. It's okay to ask those things and feel empowered to ask those things. I don't know that I would ever thought to ask those things until you told me that just now, but that makes all the sense. And I think too.
He just asking, they told me women who have adhesions will not be good candidates for that procedure. That's not true if you do it with a skilled surgeon. If you have somebody who is comfortable with doing it, and they've done a lot of them. They've done a lot of laparoscopic procedures in the case of the Acessa, because that's what it sounds like. That was their concern. When you get in laparoscopically with somebody who has a lot of adhesions, the adhesions can kind of make it difficult to see. But a skilled surgeon can work through that. It'll be a longer surgery. It will take a little bit longer to clear up those adhesions so that they can make the path clear. But if you get with someone who is confident and competent, they should be able to manage through that. So that may not be their skill set. That may not be their skill set. Okay.
Yeah.
So that they may not be comfortable with that. But other doctors certainly can probably do that. Or you may be a candidate for the Sonata, which is the one that goes through the uterus, and you don't even have to worry about the adhesions inside the belly. That doesn't matter.
So I would say, because I think we're going to wrap up. So if there's anybody out there that has questions, please post them. We're here to answer these questions. This has been so awesome. I feel like Sonata, Acessa, a lot of those are new words. Some women may not even know about myomectomies, especially if we're just sort of letting our doctors kind of just drive
what
they think is right for us.
That's right.
I think what I'm learning today from you, Stacey, is that you have to be empowered to ask questions, and you have to do your due diligence and start to look into these things on your own to find out what are your options.
Yes.
What do you think, would be the best option for you in your future? So I just want to leave with that. Like, that's what this is all about. This is just about getting all the information and the insights from Dr. Stacey. Thank you so much. But I wanted to see if there are any questions. I don't think we have anything. I don't see any more. But Stacey, Dr. Stacey, do you have any closing remarks or anything you want to say?
That's, the bottom line is that we have come a long way in the treatment of fibroids, and we're still not where we should be in terms of the research being out there. But definitely, there's much more than a hysterectomy available. And so that's always my take home point. I know, again, it's very enticing to hear, oh, you won't ever have to deal with your periods again. Ha, ha, ha. And, coming from a male doctor, but it's like, sir, I don't want to be having bladder leakage, and I don't want to be because sometimes you can have painful sex for the rest of your life after your uterus is removed. If you get scar tissue developing in certain places, you can
do they tell us these things?
They don't tell this stuff. They do not. This should be part of the counseling, but it's often not, because, like I was saying before,
they want to book for surgery
to get the surgery done and move forward in that way, and we'll deal with the complications later. So that's why I'm here. That's why I want to let patients know, especially young Black women, don't let these things remove your uteri without a good reason. If you don't have a 20-week uterus that's up to your belly button, right? Because that uterus probably needs to come out. If you've had all your kids and your uterus is sitting up here and you're short of breath because it's pushing up on your diaphragm like you're pregnant and it's full of fibroids, okay, that uterus probably does need to come out for real. Okay? But I'm talking about 1 or 2 centimeter fibroids, couple fibroids that may be 4 or 5 centimeters. They can pull those out. They can do things about those, and they can help you get back to your life sooner. A hysterectomy really has you down for 6 to 12 weeks. It's a big surgery.
So I hear you saying a hysterectomy really should be the last resort, but really look into those other options. Ask your doctor if they don't have the answers. If they don't have a great success rate, if they've never done it, then seek out the people that do it. Because these are lifelong, impactful changes. So we want to make sure you're doing what's best for you. Dr. Stacey, I love you. I'm just so I don't know. I feel so good. I feel like I'm so lucky to have you as my S4L.
I can't wait to do the next one.
Yeah, so the next
we got the little first time jitters out. We're
right.
We're ready to go.
Hit a little J for a couple of hits real quick before I did this. I was nervous. I don't like being in front of the camera, but I had a lot of fun. And next week, what we want to talk is patient advocacy. So we'll touch on a lot of the things that we talked about today, but in more depth. What questions to ask a doctor? How do doctors come to their decisions? Is it because of what they're, think is the best evaluation of you and your life? Or is it because of what they want to bill for and surgery and insurance, whatever. So we're going to get all those insights from Dr. Stacey Godley. Thank you so much.
Say things on each of our pages and just ask patients what some of their advocacy issues have been, and just kind of see, what the people in our audience would like for us to talk about too. We have some things that we're going to touch on, but I'm curious to know
always
what issues other people have run into, in terms of feeling like most of the time people feel dismissed and ignored, and just some of the questions that I speak to specifically. So maybe we can do that.
Yeah, please DM either of us. We will, we'll make sure that we get all of those questions in, and then join us and ask us during the live. This was great. I will definitely save this. I hope this was beneficial. My Dr. Stacey dropped hella gems. So thank you so much. Bye, y'all.
Bye.